We're happy to bring back Dr. Anyimadu to answer questions about the coronavirus. He is an infectious disease specialist at the Hospital of Central Connecticut. Doctor, thanks for being with us again. Nationally, there are a number of people who have survived COVID who are now sharing stories about experiencing hair loss, even coming out in clumps. Why is that?
You know, personally, I haven't seen any patient with hair loss directly due to COVID-19, but I've heard about it and I've read about it too. Like many of the complications of COVID-19, the pathophysiology is not entirely clear, but I can understand why that's possible because there are several studies that have clearly associated severe illness and stress with hair loss. And COVID-19 is no exception. It causes a lot of stress on our bodies and therefore can lead to hair loss. There's still a lot to learn about this virus.
Okay. What kinds of specialists do COVID patients end up seeking out once they've recovered from the virus, but they still have these post-lingering issues? We've heard about rheumatologists or having to go to a cardiologist.
So there are some rheumatologists that are seeing a lot of post-COVID patients, but most of the brunt is being borne by primary care physicians. They are sort of filtering patients from specialists. So primary care physicians are seeing most of these post-COVID lingering symptoms.
Okay. And the last time we talked to you, the CDC was recommending that anyone diagnosed with a mild case of COVID-19 self-isolate for 14 days. That's now changed to 10 days. What are your thoughts on that?
So there is some confusion, and we all make the mistake of confusing isolation with quarantine. And I think we need to understand both terms very well before we can understand the CDC recommendation. Isolation refers to separating someone who is sick from others, whilst quarantine refers to separating or restricting the movement of people who have been exposed to the virus and have a potential of becoming infected. So patients who are being quarantined don't have the infection. So the CDC still recommends that people with the infection should isolate for 10 days from their initial positive PCR test.
Okay.
If they don't, they should do that if they don't have fever for about 24 hours without any fever-reducing medications. On the other hand, for patients who are on quarantine, the CDC still recommends that they have to be on quarantine for 14 days. And this is based on the fact that the incubation period of the virus of COVID-19 is between 2 to 14 days.
Okay. Doctor, thank you again for answering our questions and bringing some information to light. We will see you next week.
You're very welcome, as always.